Have you ever noticed something small about your elderly parent? A shift in their energy, a change in how they speak, a few pounds lost that no one really talks about? Maybe it felt too subtle to mention. Maybe you told yourself, that's just part of getting old. But deep down, something didn't sit right. That quiet instinct? It matters more than you might think. The truth is, many signs that someone is approaching the final stage of life don't come with flashing lights or medical alarms. They come in whispers, a skipped meal, a confused look, a nap that stretches longer than usual. These aren't always things we recognize in the moment. But later, we look back and wish we had understood what they really meant. In this video, I want to help you spot those whispers early, before regret has a chance to set in. We're going to talk about 5 commonly missed signs that often show up in the last year of an elderly person's life. And I say this not to scare you, but to empower you. Because when you understand what's happening, you can respond with compassion instead of confusion. You can prepare emotionally, practically, spiritually, and you can be present in a way that brings peace, not panic. So let's begin. The first sign is something many families overlook until it becomes impossible to ignore. Let's talk about weight loss. Not the kind that comes from a new diet or more walking. I'm talking about unintentional, unexplained weight loss. And in elderly parents, this can be a loud internal signal, even if it shows up quietly on the outside. At first, it might be subtle. Maybe dad's belt suddenly needs a new hole, or mom's favorite cardigan drapes more than it used to. You may even catch yourself saying, she's looking thinner, but brushing it off as nothing serious. Here's why that matters. As we age, the body naturally loses some muscle mass, but when the pounds start slipping away too quickly, and especially when muscle seems to vanish faster than fat, it can mean the body is no longer absorbing nutrients the way it used to. It's as if the engine is running low-grade fuel and can't quite convert it into power anymore. One of the most heartbreaking things I've seen, whether as a caregiver or talking to others in the same boat, is the moment when a family realizes that no amount of favorite meals or high-protein shakes seems to reverse the trend. The appetite keeps shrinking. The joy of food fades. And eating feels more like a chore than a pleasure. This isn't laziness, it's biology. When the body begins preparing for its final phase, it often turns down the hunger signals. The digestive system slows. The brain doesn't get the same alerts saying, feed me. It's not personal, it's part of the natural slowing down. But there's more. Sometimes the cause is deeper than appetite or absorption. It could be an underlying illness, like undetected cancer, kidney disease, or heart failure. Or it might be emotional. Depression and early cognitive decline can also quietly suppress hunger, making mealtimes confusing or unappealing. If your parent is losing weight despite eating enough, it's time to dig deeper. Look at what they're eating, not just how much. Are they struggling to chew? Are meals too exhausting to prepare or finish? Are they avoiding food altogether because it makes them nauseous or anxious? When this kind of weight loss shows up, especially along with tiredness or weakness, the best thing you can do isn't always to push food. Sometimes it's about shifting your approach. Focus on small, nourishing meals that are easy to chew and digest. Offer sips of smoothies instead of full plates. And most of all, bring peace to the table. Let meals be about presence, not pressure. Because forcing them to just eat more can feel like a battle. What they need is comfort, not conflict. Now let's move to the second sign. And this one is even more invisible, yet it affects everything. Extreme fatigue and weakness. I'm not talking about the normal tiredness that comes after a long day or a poor night's sleep. I'm talking about the kind of fatigue that lingers, the kind that doesn't go away, no matter how much they rest. You might see it in how long it takes them to get out of bed, or how just walking to the bathroom now feels like a trek across the Sahara. You might notice your parent sitting more, sleeping more, or hesitating before every step, as if gravity has suddenly become heavier. What's happening here is profound, as the body begins conserving energy for only its most essential tasks. Breathing, circulating blood, basic awareness, it slowly lets go of the extras. Movement, conversation, even digestion, they're no longer top priorities. And when you think about it, the body is incredibly wise. It knows when to start slowing down long before we do. But fatigue like this doesn't just affect the body, it takes a toll on the spirit, too. Many seniors who were once independent and active begin to feel like they're losing their identity. They may become frustrated that simple chores now exhaust them. They may grow quiet, embarrassed to admit they can't do what they used to. Or worse, they might stop trying altogether. This is where families can make a powerful difference, not by urging them to get up and move more, but by giving permission to rest without guilt. To offer support without making them feel like a burden. To sit beside them, even in silence, and let them know they're still deeply valued, even when they can't do much. If your parent is sleeping more, avoiding activities they once enjoyed, or simply seems slower than usual, don't rush to fix it. This kind of fatigue is not something to push through. It's something to honor. And in honoring it, you open the door to meaningful care. Maybe that means hiring someone to help with daily tasks. Maybe it's creating a quiet routine they feel safe in. Or maybe it's simply being present in a way that reminds them you're still here and they're not alone. If you're still watching, thank you. This kind of topic isn't always easy to sit with, but it's incredibly important. Your willingness to understand these signs can help you show up for your loved ones in ways that truly matter. And if any of this resonates, if you've noticed subtle weight loss or that lingering tiredness in someone close to you, drop a comment below and let us know you're here. Just type, "I see the signs," so we know we're not alone in this. Make sure to like this video and subscribe if you haven't already. Your support helps us keep creating heartfelt, helpful content just like this. Now, let's continue, because there are more signs to watch for and more ways we can care deeply in this important time. Sometimes the most painful changes don't happen in the body. They happen in the way someone looks at you or forgets to, in the way a familiar face becomes unsure, or a warm voice goes quiet in the middle of a sentence. It can feel like your loved one is slipping away before they're really gone. And that brings us to the third sign: cognitive confusion and emotional withdrawal. Now, a little forgetfulness is normal at any age. We all misplace our keys or blank on a name once in a while. But when it's something more, when someone starts forgetting familiar places, repeating questions in the same conversation, or calling loved ones by the wrong names, it's time to pay attention. Because in the final year of life, the brain often begins to slow down just like the rest of the body. And the changes can be surprisingly quiet. You might notice your parent zoning out during conversations, or they might start skipping social events they once looked forward to. They may seem fine one day and deeply disoriented the next, switching between clarity and confusion like a flickering light. This happens because the brain, just like the heart or lungs, relies on oxygen, blood flow, and nutrients to stay sharp. And when the body starts conserving energy, those resources shift away from memory and focus. Decision-making becomes harder. Emotions become harder to express. Conversations, once a joy, begin to feel like work. But there's something else that makes this stage especially hard: the emotional distance. Even when physical health remains somewhat stable, many elderly parents begin to emotionally withdraw. They stop initiating conversations. They seem distant, uninterested, or distracted, even when surrounded by family. This isn't because they don't care. It's not a rejection. It's often because they no longer have the energy to stay engaged the way they used to. And sometimes they pull back as a way to prepare, subconsciously, for what's coming. For many, it's a way of letting go gently, step by step. To families, though, this can feel like being left behind. You may feel helpless, wondering if you're doing something wrong or if your parent is giving up. But what they need most in this stage isn't fixing. They need your quiet presence, your reassurance, your understanding. This is when your tone matters more than your words. A gentle voice, a hand to hold, a familiar song in the background. These small things can create powerful moments of comfort, even when clarity fades. One woman once shared how her mother, deep into cognitive decline, could no longer remember her name. But when she sat down and hummed the lullaby her mom used to sing to her as a child, her mother reached out and held her hand tight. No words were needed. That connection, that love, was still there. So if you see confusion increasing or notice your parent becoming less emotionally responsive, try not to panic or overcorrect. This is a time for presence, not pressure. A soft light in the room, familiar smells, a comfortable chair by the window. These can provide more comfort than conversation ever could. Now let's move on to the fourth sign. This one often shows up physically, and yet it's just as easy to miss. Let's talk about frequent infections and slow healing. You might notice that your parent starts catching colds more often, or maybe they've had a UTI 2 or 3 times in just a few months. Cuts that used to heal in a week now linger for weeks. A bruise from a small bump seems to spread and darken more than it used to. These aren't just random inconveniences. They're quiet signs that the immune system is struggling. The body, especially in its later years, is like a fortress that once had a strong army of defenders, white blood cells, skin barriers, fast healing. But over time, those defenses get weaker. The immune system becomes slower to respond, slower to recover. And when the body is nearing the end of its journey, it often stops fighting entirely. For elderly individuals in their final year of life, infections don't always show up the way we expect. A fever might not be high. A serious infection might not cause pain. Instead, you might see increased confusion, more sleeping, or a sudden dip in appetite. I once knew a man in his late 80s who went from reading his newspaper every morning to sleeping through breakfast 3 days in a row. His family thought it was just fatigue until they learned he had pneumonia, and he never even coughed. That's how quietly the body can hide infections at this stage. Chronic wounds are another red flag. If a small scratch won't heal or pressure sores begin to appear, it may be because circulation is compromised. The heart is prioritizing the brain and core organs, leaving the skin and extremities with minimal blood flow. This means oxygen isn't getting where it needs to go. Nutrients are delayed. Healing slows dramatically. This is also why antibiotics sometimes stop working the way they used to. The medication may not reach the infected area effectively, or the body may be too weak to respond, even with help. At this stage, the goal often shifts, not from curing the problem, but from comforting the person. And that's a difficult shift for many families. We want to fix things. We want to bring in one more specialist, try one more round of medication. But sometimes, the kindest thing we can do is stop chasing fixes and start focusing on care. Gentle hygiene, comfortable clothing, clean sheets, hydration, a quiet, soothing environment. These simple acts, though they seem small, can offer dignity, relief, peace. If you're noticing that your elderly parent is getting sick more often, or that small injuries are healing slower than they used to, take it seriously. These are not just signs of aging. They're the body's way of saying, I'm getting tired. So ask yourself, what would bring them comfort today? Not just survival. What would help them feel safe, cared for, and respected, even as their body weakens? Because when medical intervention can no longer restore strength, comfort becomes the most powerful medicine we can give. If you're still with us, I want to say thank you. This topic takes courage to face, and if you're nodding along, if you're seeing these signs in someone you love, know that you are not alone in this. Leave a comment below with the words, I'm listening, if this part spoke to you. I read every single one of your messages, and your stories remind us all why this work matters. Sometimes what we hear, or rather how we hear it, tells us more than any blood test or doctor ever could. A breath that sounds slightly different, a pause that wasn't there before, a strange rhythm in the silence of the room. That brings us to the final and often most misunderstood sign that the body is nearing its last chapter, changes in breathing and circulation. Now, let me be clear, breathing patterns don't change overnight. It's not usually dramatic like in the movies. It starts small, almost unnoticeable. Maybe your parent begins to breathe more shallowly, or they start to sigh more often. Or maybe there are longer pauses between breaths. You might catch yourself holding your own breath, just listening to theirs. This happens because as the body begins to shut down, the lungs and heart aren't working together in the same rhythmic way they once did. The body is conserving its energy, and the act of breathing, something we take for granted our entire lives, becomes more labored, more intentional, and eventually more irregular. One pattern you might notice is something called Cheyne-Stokes breathing. It's a cycle where the breath speeds up, then slows, then stops briefly before starting again. It can sound unsettling at first, almost like the person is struggling or gasping. But in many cases, it's the body's natural way of preparing. It's not always painful. In fact, most people experiencing this are unaware it's happening. Alongside these changes in breath, there's another shift that families often don't connect at first. Circulation slows down. Blood begins to pull inward toward vital organs. The hands, feet, and even the tip of the nose can feel cold to the touch. You might notice the skin becoming pale or slightly bluish, especially around the fingernails and lips. This isn't something to fear. It's simply the body directing its remaining strength where it's needed most. And yet, seeing these changes can be emotional. I remember one daughter sharing how she rubbed her mother's hands, trying to warm them up, unaware it was part of the natural process. She cried when a nurse gently explained that her mom wasn't in pain, just in transition. Another clue is how shortness of breath can increase even with little movement. A simple sentence can leave them winded. Sitting up might become exhausting. They may start sleeping propped up, or prefer a recliner to bed because lying flat becomes uncomfortable. In some cases, you'll also hear a slight gurgling when they breathe. It might sound like congestion, but it's actually fluid building up in the lungs, not from illness necessarily, but from the body's systems slowing down. So what can you do in this moment? The goal here is comfort. Create an environment that feels peaceful, safe, and familiar. Keep the room cool, but warm their hands with a soft blanket. Use a humidifier if the air feels dry. Offer small sips of water if they're awake and able. And most importantly, stay present. If they seem anxious or restless, gentle reassurance can go a long way. Your calm energy matters more than you know. If medical support is available, oxygen therapy or low-dose medications may help ease discomfort. But often, what makes the biggest difference isn't medical. It's you, your voice, your presence, your willingness to simply be there, holding space without trying to fix what can't be fixed. And I want to say this, especially if you're going through this right now. You are doing better than you think. Just by watching, by learning, by caring, you're already giving your loved one a gift so many never receive, the gift of being seen, honored, and not left alone in their final stage. It's not easy to witness these changes, but knowing what to expect gives you a deeper sense of peace. You'll stop looking for what's wrong and start focusing on what's still possible. Love, presence, comfort, grace. Let's take a moment to reflect together. We've talked about 5 signs, often missed, yet deeply important. Unintentional weight loss, deep, unrelenting fatigue, cognitive decline and emotional withdrawal, frequent infections and slower healing, and finally, changes in breathing and circulation. Any one of these on its own can feel small, but together they paint a picture. A quiet story the body is telling, preparing itself and its loved ones for what comes next. And I want to remind you, these signs don't mean you're losing your loved one tomorrow or next week. In many cases, they appear months, even a year before the final days. But they are signals, gentle calls to shift from doing to being, from pushing for more time to embracing the time you still have. So what do we do with this knowledge? We use it to create moments. We take pictures. We share old stories. We sit in the stillness and say things we've been holding on to for too long. We stop measuring how much time is left and instead ask, what can I do today to bring comfort, connection, and calm? There's something sacred in being with someone at the end of their journey. It's not about dramatic gestures, it's about presence. Love doesn't need to be loud. Sometimes the most powerful expressions are a warm touch, a whispered thank you, or a simple, I'm here. If you're noticing these signs in your elderly parent, take a deep breath. This is hard, but you are not alone. Others have walked this path, and so many of us are here with you, supporting you from afar. And if this video helped in any way, if it gave you clarity, comfort, or even just a little more understanding, I'd love to hear from you. Leave a comment below and share what resonated with you most. Or simply write, I'm here with them, if you're sitting beside someone you love right now. Please also like this video if it brought you value, and subscribe so we can continue sharing insights that make a real difference in these quiet, powerful moments of life. We don't always get to control the ending, but we can choose how we show up in it. Here's to giving our loved ones the dignity, comfort, and presence they deserve. And here's to you for showing up, learning, and leading with love. Take care, and we'll see you in the next video.